Senator Siri Carney.
Thank you, Cathaoirleach, and thank you, Minister. Minister, I rise to raise the issue of the fact that the public health nursing services have been removed from Curlew Road, or are about to be removed from Curlew Road Healthcare Centre in Drimnagh over to Armagh Road Health Centre in Crumlin. The questions have already been asked on this in regard to the Joel, and the responses coming back has been that there is going to be it is a temporary measure, that there is going to be a mother and child clinic. However, I need to really impress on the decision makers here that it just isn't acceptable that the area of Drimnagh is left without a public health nurse service. You know, if we look at it, and I want to contextualise that because somewhere in the heads of those who make decisions, Drimnagh, Crumlin, they're all lumped together and people just take them en masse. Drimnagh is an area, has a population the size of Cove. It has currently got building work going on in it and planning permissions going on it, that very, very soon it's going to be, Drimnagh on itself is going to have a population the size of Newbridge. The people of Drimnagh since 2011 have been promised a primary care centre when 20 announcements were made. 19 of those primary care centres have been built. The Drimnagh one, we have some, promise of December of next year or the last quarter of next year for the turning of the sod on that. In the meantime, the people in Drimnagh are expected, elderly people in Drimnagh are expected to travel now over to Crumlin, to Armagh Road, where there isn't a directly connected bus service unless there is a very long walk. It is simply not good enough. The area of Drimnagh has 2 GPs. They've been stripped out of their physiotherapy. They've been stripped out of their social care. All of those are all gone already over to Armagh Road. So the services, the health services to the people of Drimnagh have been just completely stripped away, and it is not acceptable. There's been no consultation with the residents, no consultation with the Alzheimer's daycare unit that's based in the Mother Macaulay Centre in Curlew Road. The HSE own a vast amount of land on Davitt Road, and it's just sitting there idle with nothing happening on it. No consultation, no plan, no engagement with residents. There's the most fantastic group there of Dynamic Drimnagh who are ready to engage, have well thought through plans, well thought through thoughts that will serve the people. But all that happens in Drimnagh is building planning permission on planning permission on planning permission, most of them built to rent, so you have a transitory population with no infrastructure, no supports, and now we have this additional insult that the 12,500 people in Drimnagh don't deserve a public health nurse, and that it's acceptable somehow to leave them without it. Well, it isn't, and the people of Drimnagh are going to be very active in expressing their view on that. And the reason that's given is that there's a shortage of staff in Armagh Road. I'd like to know why there's a shortage of staff in Armagh Road. We've already had a commencement last week on it. You have right next door to the Armagh Road, you have a special needs school. This was promised 2 hours a week for their 43 children, and in that context, they can't even deliver the 2 hours a week because the turnover of staff in the Armagh Road facility is so incredibly large. So there is something going on there, and now the people of Drimnagh are expected to pay the price for that, in addition to the stripping out of services in any case in Crumlin. But that the people of Drimnagh deserve their own primary care centre, and they deserve this situation, this decision on primary health care service or the public health nurse service. They deserve that decision to be reversed as a matter of urgency.
Thank you, Senator. Minister.
Thanks, Chair. On behalf of Minister Donnelly, I would like to thank Senator Siri Carney for raising this matter and for the opportunity to update the House. Public health nurses play an extremely valuable role within the community health care system, and it is vital that local communities such as Drimnagh have access to public health nurses and the extensive range of services that they provide. However, the public health nursing service in Dublin South West is currently dealing with significant staff shortages. These shortages are mainly due to reductions in the availability of staff due to retirement, internal movement and leave. Despite ongoing efforts, including recruitment campaigns and attendances at both national and international recruitment fairs, the recruitment of public health nurses continues to prove particularly challenging for the Dublin South West area. The HSE has assured Minister Donnelly that it will continue to make every effort to provide the required nursing services to the population despite these recruitment difficulties. In light of these staff shortages, the Public Health Nursing Service in Dublin South West has taken the decision to pool resources as a short-term mitigation measure. This will ensure that any impact on service provision is kept to a minimum. The Public Health Nursing Services will be consolidated in Armagh Road, with a satellite clinic to be provided in Curlew Road. It is hoped that the provision of this satellite clinic will ensure minimal impact on service users. It is also important to note that this change will see no impact to those receiving domiciliary nursing services. The HSE expect implementation of this process to begin the week of April 3rd, 2023, with a communication letter to be issued to service users and relevant stakeholders in advance of this date. Very importantly, the HSE has advised that this measure will be subject to daily monitoring to ensure continuity of care and to manage risk. The HSE has also reiterated that, as and when staffing levels increase, nursing staff will return to Curlew Road. Minister Donnelly has also been informed that occupational therapy services, dietetics and additional services will all continue to be provided from Curlew Road Health Centre. In addition, in response to the broader challenges of recruitment and retention of public health nurses, the HSE established a Community Nursing National Oversight Group last year. The group is tasked with developing proposals and recommendations which will aim to address issues in the recruitment and retention of public health nurses and community registered nurses. Of course, the Department recognises the stress and frustration caused by the shortages of public health nurses. The Department and the HSE would encourage any service users with concerns to contact their local public health nursing service directly.
Senator Carney, Siri Carney.
Thank you. Minister, if you were standing up, and you wouldn't stand up and defend the stripping out of public health nurses from a service to a town the size of Killarney. You wouldn't do that. That decision would never be made because it's seen as a distinct area, as a distinct town, deserving of its own and entitled to its own services. Drimnagh is no different. Just because it is in Dublin City doesn't mean that it doesn't deserve to be red-circled and have its own services. The people of Drimnagh have been let down since 2011. They haven't had a delivery of the services. They haven't had a prioritisation. We get some wishy-washy promise of the primary care centre. We don't get actual plans, actual decisions, and now we're stripping out their public health nurses as well. So all that's happening is whatever they had is being diminished and diluted all of the time, and it simply is not good enough. It needs to change, and the people in Drimnagh deserve to be prioritised as a matter of urgency, and this decision needs to be addressed. And what I would like to know is how many other centres were considered to have public health nurses drawn from there to preserve the public health nurse service within the Drimnagh, within the Curlew Road Centre. Nowhere else, because there are handy people to just pull over and into Armagh Road, and maybe the people of Drimnagh won't have anything to say. Well, actually, the people of Drimnagh will have a lot to say about this, and it is not acceptable, and the decision needs to be reversed.
Thank you, Senator Siri Carney. Minister.
Thanks. Minister Donnelly fully acknowledges the Senator's concerns and indeed the concerns of the community in Drimnagh regarding the relocation of the public health nurses from Curlew Road Health Centre to the Armagh Road Primary Care Centre. However, it is important to note that this is a short-term measure to pool resources while recruitment challenges exist. The introduction of this measure will allow the service to provide better continuity of care while ensuring that those with the greatest clinical need continue to be seen in the community. The Department has also received assurance that this measure will be under daily review and to ensure the delivery of a safe service. The population of Drimnagh will continue to be served, the Curlew Road acting as a satellite clinic, and once staffing levels increase, nursing staff will return to Curlew Road Health Centre. While every effort is being made to address the recruitment challenges in the short term, including ongoing campaigns, there are longer-term recruitment challenges facing a range of sectors, including the health sector. It is expected that the recently established Community Nursing National Oversight Group will propose recommendations later this year that aim to address some of those longer-term issues regarding the recruitment and retention of public health nurses and community registered nurses. Minister Donnelly wishes to reassure the Senator that the Department of Health and the HSE will continue to work together to review and monitor the service levels and will work to utilise all practical options to fill vacancies, whether they exist in Dublin South West or elsewhere.